Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
And starting this week, our Neighborhood Health Watch segment gets a shakeup. Now doctors will join us live once a week in the studio to answer your questions about the big health issues going on in our community. And first up is Dr. John Dido, who is from Virginia's Institute of Advanced ENT Surgery. Doctor, thank you for being here.
Thank you.
And we are going to talk to you today about otitis media, which is fluid that kind of lingers behind the eardrum after an infection. And how would someone even know that this is a problem?
Well, that's a very interesting question. Usually they do not. It's a silent problem that occurs after an acute infection where fluid develops behind the eardrum. A child or an adult, it's rare in adults, more common in children, that they can develop this fluid. Usually they can have hearing loss, balance disorder, or if they're having trouble in school during a school screening, they can find that they have hearing loss.
And you mentioned the infection. Is that kind of the root of the problem? What causes this?
That's correct. Acute otitis media is the most common cause, and that's the common ear infection that children get.
And how do you treat this? How do you go about fixing this problem?
Well, there are several ways. One, observation. Once you find it, studies have shown that it usually clears within 3 to 4 months on its own. However, if it doesn't, then after 4 to 6 months, you might want to consider either treating the patient with steroids or even consider placing tubes in the ears.
And is this something that requires going to a specialist like you, or is it something that their pediatrician can take care of?
Well, the pediatrician can take care of the initial onset of the disorder, but for the definitive therapy, surgery, they usually need surgery and need to see an ear, nose, and throat doctor.
All right, great. Dr. Dido, thank you so much for your information on this. Very informative. We appreciate you being here.
Thank you.
All right. And let's get a check now on the forecast, and Samantha's standing by with a look at what it's like.